Welcome to the Quick Learn session on reporting weekly cumulative COVID-19 vaccination data. My name is Elizabeth Kalisle, and I work with the Division of Healthcare Quality Promotion at CDC. This presentation is part of the National Healthcare Safety Network, or NHSN, Quick Learn series. Our goal today is to make sure facilities can confidently report cumulative COVID-19 vaccination data through NHSN. In today's presentation, we'll define cumulative data and explain how this differs from incident data. We will then go over how to calculate cumulative COVID-19 vaccination data. The last part of the Quick Learn includes a live demonstration on how to enter cumulative data into NHSN. This Quick Learn is geared toward facilities who enter COVID-19 vaccination data into NHSN. Currently, there are 4 COVID-19 vaccination modules in NHSN for collecting data on the following: residents in long-term care facilities, healthcare personnel in long-term care facilities, healthcare personnel in non-long-term care facilities, for example, hospitals, and patients in outpatient dialysis facilities. The next few slides will give an overview of cumulative vaccination data. Now we will talk about the difference between cumulative and incidence vaccination data. Cumulative vaccination data are the total number of individuals who have ever received COVID-19 vaccine, and this is since the vaccine became available in December of 2020. On the other hand, incident vaccination data are the number of new individuals who received COVID-19 vaccine in a specific week. Please remember that facilities should not report incident COVID-19 vaccination data in NHSN. When entering data into NHSN, facilities need to report COVID-19 vaccination data for question 2 of the COVID-19 vaccination modules. This means facilities need to report the cumulative number of individuals in question number 1 who have received COVID-19 vaccines at this facility or elsewhere since December of 2020. Therefore, the cumulative number of individuals are all those who have been vaccinated, and not just those vaccinated during their reporting week. Please be aware that slide 19 of this presentation includes other training resources that may be helpful to facilities. Slide 20 provides additional information about completing required questions that are part of the COVID-19 vaccination modules. So let's go over an example of reporting cumulative vaccination data. In the first week of data reporting, 5 individuals received dose 1 of the Moderna COVID-19 vaccine. So for the first week of reporting, the cumulative number of individuals receiving dose 1 of the vaccine is 5. In the second week, 5 more individuals received dose 1 of the Moderna COVID-19 vaccine. So for the second week of data reporting, the cumulative number of individuals receiving dose 1 of the Moderna vaccine is 10. To arrive at 10, you would add the 5 individuals receiving COVID-19 vaccination from the first week to the 5 individuals receiving COVID-19 vaccination during the second week. Now that we have defined cumulative data, we will review how to complete question number 2 of the NHSN COVID-19 vaccination modules. For question 2, facilities will report on the cumulative number of total vaccinated individuals. Once you're on the data entry screen, you will see a drop-down box of the COVID-19 vaccines. Simply select the vaccine for which you would like to report data. At this time, you will see the Pfizer, Moderna, Janssen, and unspecified manufacturer vaccine options in the drop-down box. Second, you will enter the cumulative number of individuals who have ever received only dose 1 of the COVID-19 vaccine since it became available in December 2020. Third, you will enter the cumulative number of individuals who have ever received dose 1 and dose 2 of the COVID-19 vaccine since it became available in December 2020. Facilities should enter the cumulative number of individuals receiving COVID-19 vaccine at the facility or outside the facility, such as a local pharmacy or hospital. Let's look at some more examples of reporting cumulative vaccination data. This is an example for individuals receiving dose 1 and dose 2 of the COVID-19 vaccine. 20 individuals received dose 1 of the Pfizer vaccine. 1 month later, 2 of the 20 individuals received dose 2 of the Pfizer vaccine. The 2 individuals who received dose 2 of the Pfizer vaccine would then be reported as receiving dose 1 and dose 2. The other 18 individuals would still be reported as receiving only dose 1 of the Pfizer vaccine. This slide shows you how COVID-19 vaccination may be reported for individuals who were eligible to have worked at the facility for at least 1 day during the week of data collection. In this example, the facility had 50 individuals who were eligible to have worked. 10 of those individuals received their first dose of the Pfizer COVID-19 vaccine, while 5 individuals received dose 1 and dose 2 of the Pfizer COVID-19 vaccine. This example shows how COVID-19 vaccination of individuals looks during the second week of reporting. 5 more individuals received their first dose of the Pfizer COVID-19 vaccine during this week. So, at the end of the second week, the facility reports that a total of 15 individuals received their first dose of the Pfizer COVID-19 vaccine. You would also still report the 5 individuals who received both dose 1 and dose 2 of the vaccine for the previous week. This example shows how COVID-19 vaccination of individuals looks during the third week of reporting. 15 individuals received their first vaccine dose in week 2. You would then add 3 individuals who received their first vaccine dose in week 3, which gives you a total of 18. Of the 18 individuals, 10 received their second vaccine dose in week 3. Therefore, you would subtract 10 from 18. So for week 3, the cumulative number of individuals who received their first vaccine dose should be reported as 8. This example also shows how COVID-19 vaccination of individuals receiving their first and second vaccine doses looks during the third week of reporting. 5 individuals received their second dose in week 2. You would then add the 10 individuals who received the second dose in week 3. Therefore, for week 3, the cumulative number of individuals who received the second dose should be reported as 15. The next part of this Quick Learn is a live demonstration. We will go over data entry for healthcare personnel in a long-term care facility. Please note that cumulative data should be applied in the same way when entering COVID-19 vaccination data for other groups such as long-term care facility residents, non-long-term care facility healthcare personnel, and dialysis patients. The objective for the following demonstration is to provide an example of cumulative reporting of COVID-19 vaccination data for healthcare personnel in long-term care facilities. Please note that all data entered into the test facility are fictitious and used for demonstration purposes only. As a reminder, you will log into your facility in NHSN and begin by navigating to the blue left-hand bar in the NHSN application. Select COVID-19. When you click on COVID-19, you'll see the option for COVID-19 vaccination, HCW, or healthcare worker, and then the option for COVID-19 vaccination, residents. First, we will select the healthcare worker option. Remember, for the purpose of this example, we will demonstrate vaccination data entry only for long-term care facility healthcare worker options. However, the same cumulative data reporting should be used when entering vaccination data for long-term care facility residents, non-long-term care facility healthcare personnel, and dialysis patients. Once you select the option for COVID-19 vaccination healthcare worker, you'll then see the calendar format screen for vaccination data entry. So for this example, let's say we are reporting data for the week of Monday, March 8th through Sunday, March 14th. We will select this week to report. For question 1, you will enter the total number of healthcare personnel who are eligible to have worked at the healthcare facility for at least one day during the week of data collection. The facility in this example has 50 healthcare personnel that worked at the facility during the week of March 8th through March 14th. So enter the number 50 for question 1. You'll note this question is outlined in red since it is required. For question 2, you will enter the number of healthcare personnel who have ever received COVID-19 vaccination at this facility or elsewhere since it became available in December of 2020. So for this example, 30 of your facility's healthcare personnel received dose 1 of the Moderna vaccine during the week of March 8th through the 14th. Since we only had healthcare personnel receive their first dose of the Moderna vaccine in this example, question 2.4 will be 0. So we'll quickly complete the remainder of the questions on the form, since the focus of this demonstration is on cumulative data reporting for question 2. Please refer to additional trainings posted to the NHSN COVID-19 vaccination web pages for detailed instructions on form completion. Click on the Save button, and this will save your data for the week of March 8th through the 14th. So a week has gone by. In the calendar format screen for vaccination data, we will now report healthcare personnel COVID-19 vaccination data for the week of Monday, March 15th through Sunday, March 21st. Select this week to report. There was no change in the total number of 50 healthcare personnel for your facility. So for question 1, you will again enter 50 in the field. Completing question 2 for the week of March 15th through the 21st is where we will look more closely at how to report cumulative data for healthcare personnel. You'll recall that for the previous week, 30 healthcare personnel had received dose 1 of the Moderna vaccine. Since that number was reported, 5 additional healthcare personnel received dose 1 of the vaccine. Therefore, the number entered into the field for question 2.3 is 35. For cumulative reporting, you will add the number of healthcare personnel from each week who received dose 1. So the 30 healthcare personnel from the week of March 8th added to the 5 healthcare personnel from the week of March 15th would be 35. Again, we only had healthcare personnel receive their first dose of the Moderna vaccine in this example. So question 2.4 will still be 0. Complete the remainder of the required fields and save your data. The last thing we will demonstrate is how to report cumulative data once healthcare personnel have started to receive their second dose of the vaccine. During the week of Monday, April 5th through Sunday, April 11th, 4 weeks have passed since COVID-19 vaccination data from the week of March 8th were reported. Your facility still has the same 50 healthcare personnel working there. You'll remember that the cumulative number of healthcare personnel who received dose 1 of the Moderna vaccine during the week of March 15th was 35. Five additional healthcare personnel have received dose 1 of the Moderna vaccine since the week of March 15th. So as discussed before, this number would be added to the previous 35 to get 40. However, 10 healthcare personnel have received dose 2 of the vaccine as of the week of April 5th. Therefore, you will enter 10 for question 2.4 and 30 for question 2.3. Again, complete the remainder of the required question fields and save your data. You will repeat this cumulative reporting process for each week where additional COVID-19 vaccinations are provided to healthcare personnel in your facility. This completes the demonstration of cumulative reporting of COVID-19 vaccination data. You will now return to the presentation for the conclusion of the Quick Learn. The next few slides will outline some resources that may be helpful to you. The NHSN website contains links to data collection forms, tables of instructions for reporting data, training slides, and analysis and reporting guides on submitting weekly COVID-19 vaccination data through NHSN. CDC has also developed data tracking worksheets that will automatically calculate data to enter each week for the COVID-19 vaccination modules. After entering COVID-19 vaccination data for the individuals noted in the worksheet, simply select a reporting week, and the worksheet will automatically calculate each entry that should be reported to NHSN for that week. As a reminder, please note that certain fields are required for saving data in the NHSN application. These fields are noted by an asterisk and a red box in the application. These are the only fields that are required for completion. Explanations for these fields are provided in the Table of Instructions documents as listed on the slide. If you have any questions about NHSN, please send an email to user support at nhsn@cdc.gov. Please include weekly cumulative COVID-19 vaccination in the subject line of the email.